Men's mental health has become a larger topic of discussion in the past few years, but its disproportionate effect on the population continues. As of 2020, 6 million men are affected by depression across the United States each year. Conditions such as depression cause men to be more impacted by suicide than women, die of more alcohol-related causes, and are much more likely to misuse drugs. To highlight this disproportionate impact, let's go back and examine suicide rates. Overall, the US population is about 50% male. However, 80% of suicides in the country are among men. Additionally, the suicide rate among veterans was 57.3% greater than for non-veteran US adults, making veterans a highly susceptible group to mental health afflictions. This is a shocking statistic to many individuals, as I would assume that the rate would be more even among men and women, or that it could be slightly favored towards the latter. Issues such as suicide help to highlight how important it is for us to begin nurturing individuals in mental health at an early stage. Many people wait later in life when their issues become larger or more apparent before they decide that it's time to make some positive changes in their mental well-being. Often, they are stopped from engaging in positive mental practices due to stigma. Stigma surrounding mental health is nothing new and has been a constant barrier to seeking help for countless individuals for decades, especially among the male population. With the proper education and tools that will be discussed today, we can begin helping one another towards a more positive headspace. One of the easiest and most effective ways of breaking the stigma surrounding mental health is to educate yourself and those around you on the topic. Stigma tends to be born through missing or false information that has been spread through various groups from one's own culture and societal norms or family structure. Proper education on how mental health afflictions are brought about, how they can impact an individual and those around them, the signs of deteriorating mental health, and the seriousness of the consequences that can follow ignoring mental health can help to dispel any false perceptions or notions that they may have. Another way to help break the stigma is to start more conversations. Get rid of the idea that it's taboo to bring up mental states around others. Make people understand that it's okay to ask others how they are truly feeling and that they can speak up if they're in need of help as well. Half the battle is getting rid of the stigma is to let others know that they are not alone or not crazy for not feeling okay. Also, remind others that they should not be afraid to challenge false information. Remind others that poor mental health can have the same physical impacts upon a body that traditional ailments have. It is also important to understand that the methods that have shown promise among girls do not work the same for boys always. Talk therapy, for example, works very well among female populations, but the same has not been seen among men. Men prefer to learn through activities and physically doing things, so it's important that when trying to convey these messages, is done in a way that will reach the audience effectively. Lastly, make sure that mental health is not all about the bad. Bring up the positives of having a mental healthy health state and all the benefits that come with it. When should mental health resources be introduced? The short answer to this question is that mental health resources should be introduced as early as possible. People are most impressionable at early stages in their life, so it's easier to get them accustomed to positive mental practices and discussing their current mental state with others. While these individuals continue to grow and become more mature, the topics of discussion can slowly become more intense and adult. However, this does not mean that one should pretend that these more intense sides of mental health do not exist with those of a younger age. Mental health afflictions do not discriminate by age, so it is important to be ready for any discussion. Additionally, while it is important to start these resources early, it is also never too late to begin. Many individuals are not given the opportunity to learn about mental health when they are younger and face the consequences at a later age. These individuals deserve the opportunity to begin their own educational journeys around mental health and discovering what methods may work best for them. Empathy, by definition, is the ability to understand and share the feelings of another. In our case, empathy is the backbone of promoting positive mental health. As I've mentioned earlier, it is incredibly important to listen to others and make sure that they feel heard and understood in their own struggles. People are much less likely to open up and really trust in the person that they're confiding in if they feel that the individual is not understanding their struggles or that they cannot relate to how it is impacting them and making them feel. This becomes increasingly important when dealing with male mental health. As it stands, most men feel the impacts of social stigma and cultural norms that make them feel constricted about what they can do regarding their own mental health and who, if anyone, they can confide in. Approaching these individuals with a large degree of empathy allows you to slowly peel back the layers of stigma that surround them. Men may be more standoffish, depending on their local culture and societal norms, so it's important to approach the situation slowly and with care. However, this does not mean to give up if they push back. It may take a few times of approaching them with empathy to show them that it's okay to open up and that these individuals are there to listen to them and help them move past any issues that are impacting them. The three main keys to this approach are time, place, and mode. Talk with the man and figure out what place he is most comfortable talking in, like over a dinner or while playing sports. What time? Maybe he feels more willing to talk at night or on the weekends. And through what mode? Different ways of approaching the subject may be more comfortable than others. The consequences of ignoring mental health can be dire. As I mentioned at the start, about 80% of the suicides seen in the US are among males, and many of them stem from issues regarding mental health. Mental health does not only impact your internal thoughts and mood, it can have serious physical implications, impact relationships, increase risk of substance abuse, and much more. Physically, poor mental health can lead to headaches, fatigue, increased risk of heart disease due to higher blood pressure and elevated stress hormones, and it can even trigger autoimmune diseases in the body, such as psoriasis or rheumatoid arthritis. A large portion of people do not realize how physically impactful mental health can be on them and elect to push their way through whatever is impacting them. Additionally, it will cause issues in personal relationships due to communication breakdowns, emotional distance, strain on trust, codependency, and decreased intimacy. Mental health complications can cause you to push loved ones from your life who could be potential sources of support. For more information on how to avoid the consequences of poor mental health by making positive changes in your life, visit sites such as the National Institute of Mental Health, Substance Use and Mental Health Services Administration, or Men's Health Network for helpful resources.